I am pleased to report that 11,923 Albertans have now recovered from COVID-19. We identified 108 new cases in the last 24 hours. 6 of those cases are at the Bright Horizons daycare and out-of-school care location. The daycare closed on August 20th. The infant and preschool room opened yesterday, August 26th, because it had no reported positive cases. And let me correct my previous statement. All 6 cases were not detected in the previous 24 hours. These are cases that have been detected over the past several weeks. We do continue to monitor the situation at Bright Horizons. Today, there are 1,158 active cases in the province. 49 people are in hospital, including 7 in intensive care. We completed 10,089 tests in the last 24 hours, bringing total tests to 922,397 so far, with 736,405 Albertans tested. I must report 2 new deaths, bringing the total number of people who have died from this virus to 237. Every one of them was a father, mother, son, daughter, or other loved one to families and friends. I offer my condolences to all who are grieving losses of any kind right now. Protecting those we care about from sickness and death is why so many Albertans are taking distancing, sanitizing, and masking seriously. I thank those Albertans who are doing their part every day to stop the virus in its tracks. I also want to thank school staff, administration, and teachers, as well as parents and students for all the work going into planning a successful re-entry to school. Whether your family has students returning to school in person or online, this will be the first time any of us has gone back to school in a pandemic. It is natural to feel nervous, excited, anxious, or any other emotion we may be feeling right now. We have not officially restricted the number of cohorts that children can belong to. Having said that, it would be my recommendation for parents, especially as school is going back in person, to keep the number of cohorts that their children are part of to as small a number as possible. With respect to activities like, for example, swimming lessons, or there may be other activities where children can be distanced more effectively than in, for example, a close contact team sport. Again, there's nothing stopping a parent from having a child in a team sport and in swimming lessons, but it would really be up to that particular family to look at all of the activities that the household members are involved in, considering going back to school if their child is going to school in person, and considering then how they might, at least for the first month or so, limit the total number of close contacts that their child has until they can get a sense of how that plays out in their particular family and household. But again, if a family wishes to have a few cohorts, that's not forbidden. I just would ask families to consider how they might reduce the number of close contacts, especially in this next month. It is critical that we treat anyone involved in any outbreak with respect and compassion, that we support people to do the right thing, and that we think in our own lives, how can we be sure that we are taking the public health guidance to heart every single day, because it could be us who are involved in an outbreak tomorrow in an incident where perhaps there was just a slip up at the wrong place, the wrong time. So again, this is something that we are all in together.